Do you know that magnesium is one of the most underrated minerals, especially in new women over 50? And usually you have a lot of those signs of mineral magnesium deficiency and you don't recognize them. In today's video, I'm going to give you 8 scientifically proven signs that I've seen in my patients regularly, and I'm going to give you at the end of the video special doses and the supplements form, of course, and the food that had a lot of those magnesium and that you can really help yourself. My first sign is going to be night leg cramps and the muscle tension. One of the most common signs associated with low magnesium is muscle cramping, especially at night, and many people wake up with tight calves, foot cramps, restless legs, or a feeling that their muscles simply cannot relax. And this happens because magnesium is deeply involved in the muscle contraction and relaxation. And calcium helps muscle contract, but magnesium helps muscle relax. When this balance is disturbed, the muscle may become tight, irritated, and overactive. Sign number 2, and you don't really recognize this, probably over 50, you woman, you have regularly something called insomnia and the poor sleep. And magnesium is directly connected with your regular normal sleeping during the night. And magnesium is often called a calming mineral because it supports normal nerve signaling. When magnesium is low, the nervous system may become more reactive, and you may feel tired but still unable to sleep. You may wake up at 2 or 3 a.m. in the morning, and you may feel tensions in your body, racing thoughts, or feeling that your brain refuses to shut down. And magnesium is here that really can help you. That's why I always recommend my patients that have those insomnia problems, especially after 50, use magnesium regularly. Sign number 3 that you have magnesium deficiency in women over 50 is going to be fatigue and low energy. And if your body is missing magnesium, energy production may suffer. Magnesium is involved in the metabolism of carbohydrates and fats. It helps the body convert food into usable energy. This is why low magnesium may be associated with fatigue, weakness, and the feeling that your body has no reserve. And many people, they think they need more coffee, more sugar, more motivation, but the real question is, are your cells missing the minerals required to produce energy? Sign number 4, of course, if you have magnesium deficiency after 50, is going to be your problems with anxiety, depression, and low motivation, especially low mood. This is regularly something that I see with my patients with magnesium deficiency. Magnesium nourishes the nervous system. Low magnesium may be associated with anxiety, irritability, low mood, and emotional instability. And this doesn't mean that every anxiety problem is caused by magnesium deficiency. And anxiety can have many causes: hormones, thyroid problems, trauma, poor sleep, medication, inflammation and blood sugar changes, and of course the life stress. But magnesium should not be ignored. Let's continue, my dear woman. Sign number 5 that you have magnesium deficiency, of course, is going to be regularly you have headaches or migraines. And you have all those migraines couple times during the 1 month, maybe even more, and maybe regularly through the year. And you never check magnesium levels in your body, but this is one of the missing information that you really don't have if you have magnesium deficiency. This is important because magnesium is involved in blood vessel relaxation, nerve signaling, and the muscle relaxation. And some people with frequent headaches have low magnesium status, especially if they are under stress, taking certain medication, eating poorly, drinking alcohol, or losing minerals through digestion or urine. Sign number 6 that you have problems with magnesium deficiency, of course, is going to be heart problem. Your magnesium is directly connected with the heart health, blood vessels health. And if you have some kind of heart arrhythmia, you have high blood pressure, you have the risk of blood clots in your body, maybe you need to check magnesium levels. Magnesium helps blood vessels to relax and support normal heart rhythm. And low magnesium has been associated with high blood pressure, heart rhythm problems, and a higher cardiovascular risk profile. And this matters because many people over 50 already deal with blood pressure medication, cholesterol concerns, diabetes risk, and the heart disease. Okay, my dear woman, heart problem, you must check magnesium. Sign number 7, of course, is something that you never connected with magnesium. It's gonna be your sugar problems. Right now, in 2026, we have already maybe 60-70% women over 50 that have diabetes or insulin resistance. And one of the missing pieces, of course, is going to be magnesium. Magnesium plays an important role in blood sugar regulation. And low magnesium status is often seen in people with insulin resistance, metabolic syndrome, and type 2 diabetes. When blood sugar is high, the body may lose more magnesium through the urine. Then low magnesium made the blood sugar regulation even harder. This is unbelievably important, and my 8th recommendation and signs that you have magnesium problems after 50 is going to be your joint problems. You maybe have osteoporosis, you have knee osteoarthritis, you have hip osteoarthritis, rheumatoid arthritis in your hands or any part of your body. Maybe you are missing in magnesium. Okay, my dear viewers? This is 8 scientifically proven signs that you have magnesium deficiency. Now let's see how we can correct these problems. And for adults, the usually daily target is around 420 milligrams for men and around 320 milligrams for women, mostly from the food. And during pregnancy, the recommendation is usually 350 milligrams, and during breastfeeding, around 320 milligrams. Daily value often used on a supplement label is 400 milligrams. This is unbelievably important. This is like normally daily dose, but you need to check with your doctor blood sugar, blood test for magnesium levels, then you can actually get them in correctly way. What type of magnesium you can use? My recommendation is, of course, going to be use magnesium glycinate or magnesium bisglycinate, or maybe magnesium malate and chelated magnesium. Food should always be foundation, and good magnesium foods include cooked spinach, black beans, pumpkin seeds, almonds, cashew, soy milk, peanut butter, avocado, whole grain bread, brown rice, yogurt, salmon, and the milk. As I said at the beginning of the video, magnesium is one most underrated mineral generally in the people, especially you women after 50. And all those kind of symptoms, you can really fix all those kind of problems using correctly dose of magnesium. Below the video is everything that you need to know about my praxis, my consultation with people all around the world, and of course you can find a lot more information about my 4 books about nutrition and natural remedies. If you want to learn a lot more about vitamin D deficiency, watch my video right here. Thank you for following, my dear viewers. See you in the next video. Bye bye.